Hi, today we are discussing about the basics of MedDRA. MedDRA is a multilingual terminology allowing the most users to operate in their native languages. The table below identifies the initial MedDRA versions when each MedDRA language was made available to users. There are too many languages like Japanese, Spanish, German, French, Dutch, Italian, English, Portuguese, Korean, Brazilian, Swedish, Latvian, Greek, and Polish. The most important reason to code data into standardized terminology is to analyze it. A key benefit of MedDRA is in its support of straightforward as well as sophisticated analysis. MedDRA can be used to analyze individuals' medical events, for example, influenza, or issue involving a system, organ, etiology, for example, infections. Using its hierarchical structure, MedDRA can be used for the signal detection and monitoring the clinical syndromes whose symptoms encompasses numerous systems or organs using its multi-axial hierarchy or through the special features of standardized MedDRA queries. The ability to communicate adverse event data is another strength of MedDRA and has led to MedDRA being an integral part of the ICH e-submission standards, that is ECTD, and ICSRs. Next point is multilingual MedDRA. The users of MedDRA have found it to be such an important tool that in addition to English, it has been translated into multiple languages. See the multilingual access section of the MedDRA homepage for the list of currently supported languages. Multiple languages allow most users to operate in their native language, which promotes accuracy and precision of assigning terms. This interpretability is very powerful and allows easy multinational sharing of data. Supporting documentation is maintained, which is release of MedDRA for many of the languages. All MedDRA terms are assigned a unique 8-digit numeric code. The code is assigned to the translated term in each MedDRA language. This allows for the electronic submission of the same concept, for example, in an individual case safety reports ICSR in any of its language without loss of information or possible mistranslation by the sender or receiver. The Japanese translation of MedDRA is maintained by a Japanese maintenance organization, that is JMO, which works with the MSSO to assure the MedDRA J is kept in synchrony with English MedDRA. The remaining MedDRA translation are centrally maintained by the MSSO under the direction of the ICH MedDRA Management Committee, and changes to English MedDRA as are reflected in their translation also. Now, next point is MedDRA hierarchy. The structure of the MedDRA is very logical. There are 5 levels to the MedDRA hierarchy, arranged from very specific to very general. At the most specific level, called lowest level term, that is LLT, there are more than 80,000 terms which parallel how information is communicated. These LLTs reflect how an observation might be reported in practice. This level directly supports assigning MedDRA terms within a user database. Each member of the next level preferred term, that is PTs, is a distinct descriptor, single medical concept for a symptoms, sign, disease, diagnosis, therapeutic indication, investigation, surgical or medical procedure, and medical, social or family history characteristics. Each LLT is a link to only one PT. Each PT has at least one LLT itself, as well as synonyms and lexical variants, for example abbreviations, different word order. Related PTs are grouped together into high level terms, that is HLTs, based upon anatomy, pathology, physiology, etiology or functions. HLTs related to each other by anatomy. pathology, physiology, etiology or function are term linked to the high level group terms, that is HLTTs. Finally, HLTTs are grouped into system organ class and are grouping by etiology, for example infection and infestations. In addition, there is a SOC to contain issues pertaining to products and one to contain social circumstances. The next is multi-axiality. The 27 system organ classes represent parallel axes that are not mutually exclusive. This characteristic called multi-axiality allows a term to be represented in more than one SOC and to be grouped by different classification. For example, by etiology or manifestation site, allowing retrieval and presentation via different datasets. Grouping terms are predefined in the MedDRA and not selected on an hoc basis by data entry staff. Rather, the terminology is structured so that selection of data entry term leads to automatic assignment of grouping terms higher in the hierarchy. Multi-axial links of terms are pre-assigned and should not be changed, ensuring comprehensive and consistent data retrieval irrespective of which SOC is selected at data retrieval. So these are the points including the basics of the MedDRA. Thank you so much.